Hey,
Morning,
Doc. Good to see you, man. I can see you. I'm so excited. It's the first time with no contacts I can actually see. Wonderful job. I'm so glad I found the guy with the want to. Thank you.
Made my day count.
Awesome. Mine too.
Thank you for bringing the donuts. You're
You
my
bet.
only
I brought
surgeon
donuts.
patient. Oral surgeon who brings donuts and toothbrushes. I love it. Okay, you made my day. Today I've seen morning all of my post-ups. I'm thrilled, but you take the cake.
I'm ready for the next one. Let's go, baby.
Let me recover first. Oh, great. You guys are iconic. For doctors, I do these impromptu. Doc, you've been here before during your first surgery too.
I've been through the whole thing with you. I feel like I should be doing them, except I don't have your hands. You're freaking awesome.
Thank you, Kevin. But for doctors, my amazing patient again, all my patients are amazing, mind-blowing, high IQ, and I think you all drive me, Kevin. I teach surgeons all the time. They ask me, Doc, aren't you worried about them being so demanding, high IQ? And I constantly tell them, only an artist will appreciate a Mona Lisa. Because you're demanding, you'll appreciate this work, and I can share with colleagues all the time which way to go. What I'll do, Kevin, this is great if you're recording impromptu. I will draw for them like I do, because I'm also teaching a webinar in a week about these things. Your story, Kevin. Should I go through the story, or do you want to then, Kevin, impromptu, since we're already in the recording phase, you want to say that, or should I start with your story?
I can start and you can add in. How about that?
Go.
Because you know I'll talk.
Go.
First picture. Can you see that well?
Oh, okay, you're describing the picture.
Yeah.
Okay.
The scars
That's
on that is kind of after I'd been here just a little bit, because you went in and cleaned these scars to make them look better.
Yep.
And to try to get them to knit together.
Yes.
And you found that they were open. And I had, what, 18 or 20 on each eye?
Yes, 21 cuts cut twice. So yes, that's double the amount of
And they were
cuts.
very deep. You didn't really know how deep till you actually
Yes.
cleaned them out and saw how deep they were. Which,
Right.
again, for you as a surgeon, you did stage 1 of surgery.
Mm-hmm.
Okay?
Yes.
We tried to heal. We saw if it would get better.
Yes.
And then the next thing your plan was, and every time you'd say they were going to do this and see if it works. We're going to do this and see if it works. I love that. There wasn't any speed, but we didn't go something really fast to the
What
end.
I say, Kevin, and
You
again,
didn't take everything off and just start over. You
very important, Kevin, too. Great interrupting you for the doctors here. I call this, we don't have a GPS because there's no machine that can measure this. He was 2400 blind, cannot be refracted.
Oh, yeah.
Dense central scar, 21 cuts cut twice with 5 cuts that were 100% deep in the AC. I think his RK surgeon, when he did it, cut through and then stayed that way. That's why it's like this. The point I'm trying to make here is, Kevin, I did not have a GPS, but I used a compass at least to know we're going north. So we never made a mistake. That's what I call don't take wrong turns and dead ends. Plan it very, very well. That's why we took step 1, 2, 3, and where we are. So sorry, Kevin, go ahead.
No, but what you did is you told me those steps. You didn't have them completely figured out, but you knew the steps should one not work, and I love that. You know what that showed me? What did that show me?
No.
You had the want to. Once again, you had the want to do it. You didn't just go, hey, this is awful. As I had been told before, I was just very blessed that my friends, the ophthalmologists where I live, knew me well enough to not do that. They knew me to send me to you. That was the greatest move they could have ever done for me. Instead of doing something, they did nothing and turned me over to you.
That's a privilege, Kevin. They were all excellent corneal surgeons.
Yes, they are.
Referred you over. So it's an honor for me that they all send patients here from everywhere. But
okay,
sure.
second part. After we made a plan, we went. The next thing you did is you had set the groundwork up to do the lamellar surgery.
Yes.
And I don't think anybody can appreciate the precision of the stitching in this. As a surgeon, I looked at that and went, holy mackerel. That's an amazing level. And now I don't understand the eye surgery level because I'm sure many doctors can do that.
Sure.
But that to me just went, I was showing that to everybody. Here I am a dentist and we do a lot of small, we deal with millimeters and micromillimeters too.
Correct.
That's an amazing result. Amazing. And it didn't take long for me to get healed from that. I mean, you made me take a long time, but I was doing really well. Okay?
For doctors, this is a hand lamellar keratoplasty. No machine could cut through into these kind of RKs. And remember, I don't like penetrating transplant, which debilitates the patients. A dynamic man who has his life in front of him and is a surgeon. So I did a hand lamellar. Literally every cut was open as I was going with my tooth knife that I've designed. No machine can do that. Please, you have to do hand lamellar. and I then stitched him with my anti-torque suture, which is the star suture he's talking about. And what became difficult for me to do that was I was stitching through 3 cuts as I was coming out, yet wanting my symmetry and beauty that I absolutely love. So that's what this is, lamellar keratoplasty. And then we let you marinate for a year, Kevin. What I call that is, all of you have heard me talk about this and teach, let the cornea become measurable and consistent. Reliable and measurable, meaning I'm planning his cataract surgery eventually. Remember, Kevin, that's what you had under all this. But you cannot do intraocular surgery until you're confident about your corneal measurements. Otherwise, you're doing a mistake and shooting in the dark, entering the sacred eyeball.
I love seeing the topography of before and afterwards of the eye. Phenomenal topography change.
That's you.
You know.
So if y'all can see this, guys, he had 15.1 diopter irregular astigmatism in his eye before.
Horrendous.
15.1. With hand lamellar, we brought him down to 1.9. And then I measured him repeatedly throughout the year and made sure it was consistent and measurable, that I could actually measure his lens power. And then, Kevin, as I call it, the arrogance of vision, went in with a Toric Premium lens and no stitch surgery to do his cataract 10 days ago and brought him straight to vision. I'm very happy with you, Kevin. Excellent.
I'm very happy with you.
Excellent. So that's your story, Kevin.
Yep, and then the cataract surgery, again, for surgeons and actually lay people, you can see the field that's dark in the center of the eye on number 2, right? That's my cataract that I didn't know I had. And then this one is clear, and I can see clear as a bell out of that, and I could as soon as I left the table. I mean, all he did was topical anesthesia and no stitches, and I was in and out of there. And I know it's probably 45 minutes for you, but it felt like no time. And I got up, went home, I did the prescribed lay down like a vegetable for 5 days.
And you still played golf on the weekend?
No, but that was the next weekend. That wasn't that weekend. That was the next weekend. And yes, I did. I played golf. Yes, I don't work anymore. I'm retired. I got nothing to do except drive my wife crazy. But the cool thing again is that now I'm dying to get the other one done. I didn't realize how bad, even though you fixed me, the other one's just like it. So
I need to recover before you're saying
that's what you said.
Okay. So yes, what he described is very, very well taken. So we did his surgery not in a surgical center or hospital, but our institute office-based suite, where, Kevin, no drugs, no IV sedation. Even with this surgery, we went in without a stitch and came out, and surgery took a good 20-25 minutes. The planning around the surgery, again, I spend all my time. I want to make sure we get it all, because you don't want to induce astigmatism, even though stitch was mandatory in so many cuts. You can see me gone from here behind, no stitch incision here. And all RK cuts can be seen through his lamellar still today. But he's seeing without glasses. Kind of drove all the way up here. Thank you.
Yep.
So if you want, I can draw it out for patients. Surgeon, sorry, what we did. So you want to turn the lights on, Annie?
Okay.
So what we did, doctors, he had about 21 cuts RK, of which 6 of the cuts were 100% deep. That's why he was constantly getting these scars in the center that were full thickness, and he had a cataract under that, vision unmeasurable, amazing guy again, both eyes same by the way, and was left with nothing except penetrating transplant. Looking at his lifestyle, what we did is we left all the incisions there, but we did a hand lamellar surgery with a Tukes blade. I went in and I shaved off this portion of his cornea, which was actually down to about 280 microns thickness. So my reasons to do a lamellar, remember, in my 5S system, otherwise I go straight laser. So we built up his cornea while getting the center clear and giving him strength. You can still see the cuts through this, but the center was clear. Now that center was clear, and then Kevin, I measured, remeasured you so many times to make sure it was accurate and reproducible. Because that led me to pick the lens power with my formulas that I do for these cases. And we were so arrogant about vision, we went with a premium toric lens and brought him straight to vision without glasses, which is where he is today now. So that's the concept. So no RK case, there is no RK case that cannot be corrected. There is no case that is complex. Think through my 5 systems of teaching, Kevin, you and me were discussing just now, right?
Right.
Is just being able to do cataract or LASIK or SMILE or any surgery is a technical proficiency. It's not surgery. To me, a surgeon is someone who can then perform those techniques consistently with zero retreatment, no complications. Then that surgeon becomes an artist when you can perform elegantly with no pain to the patient with topical drops and the patient doesn't feel anything, and the whole thing is elegant, symmetric, and beautiful, including a pterygium surgery, no blood next day. Then that artist becomes an architect when you take the pieces of each surgery, whether it's hand lamellar, cataract, laser techniques, anything, and you can arrange them as a constructive board. Now you're a vision architect. So you went from technician to surgery to artist to architect. Now you become a maverick when you can play around with all pieces and use the correct GPS, I call it, right? Meaning which sequence to do first. If you had done the transplant first, which is what many surgeons recommended, you'll be lost in doing his cataract surgery, and you surely wouldn't land without glasses. Nothing wrong with that, but it's not the outcome a doctor or a patient wants. So the stages of teaching, the way I like to talk, is if you're doing cataract, LASIK, SMILE, any other surgery, is technical. Surgery, or you're a surgeon when you're consistent and amazing, 100%. Then artistry, then architect, then maverick. Then I teach the other level, which Kevin has given a name today.
Which is the Gulani level? Well, come on, man.
But I still feel, Kevin, that's a level of freedom. I haven't found a name yet for that level.
Right.
Where you have no, I shouldn't say no fear, but you really are so confident, but because your patients become your team, you are not anxious about anything. You help your colleagues, you help the industry, you're free. You're free to spend this time with, I saw you for like, what, 2 minutes, Kevin? And we're chatting away, and now suddenly it's an impromptu video for my colleagues, surgeons everywhere. So that's the levels of which I like to teach, which is part of my master class I'll be teaching next weekend.
Please don't discount want to. You've reached the maximum level of want to. There's a lot of people that don't. There's a lot of people that say, this is enough, I'm good enough. You gotta want to do this, and that makes you special. That makes you special, and whoever's watching this, to be able to do this will make you special in your patient's eyes. Trust me. I was trying to attain that in dentistry. I didn't get there because I got waylaid, but it's true in yours. You had want to from the beginning. Congratulations. It was I don't know if it's DNA or just your heart, but that's where it is.
I don't know, Kevin. I just feel I'm privileged. All of you, your trust, this is how I would repay all of you. Every patient in our institute is like a conference.
Yeah, we all feel like you're friends. Really, we actually chat, with each other in and out. It's really kind of nice.
So for all the doctors, guys, we're just having more fun with my patient now. We'll have donuts, but I hope that helps you guys. All right? See you guys soon. Take care.